Unit 5, Promoting Health and Wellbeing, and the title of today's lesson is The Benefits of Health Promotion for the Nation. So what we're going to be looking at today is how health promotion can benefit the nation. So when I say the word benefit, I mean how it helps. So we're going to be looking at the different ways health promotion can help the nation. Now, the nation is a large group of people, and the nation that we live in is Great Britain or the UK. So just remember that everything we're looking at today focuses on the nation, not on the individual, but the nation. So larger groups of people. Everything we do in this lesson links to P2, M1 and D1 in your assignment. So the aims and the outcomes of today's session. The aim is for you to all gain knowledge and understanding of how health promotion can benefit the nation. I'm quickly going to talk you through what we've covered over the last few weeks. So we will, for our first outcome, review learning from the last lesson. And then we'll move on to looking at the different ways health promotion can benefit the nation. So we're going to identify and discuss at least 4 ways that health promotion will help the nation and justify the different ways that health promotion can benefit the nation. So we'll identify and discuss them, and then we will justify. And what justify means is give the reasons why. So we will look at the reasons why certain activities can benefit the nation. And then you can start to begin to plan your assignment as well. Now, your assignment is going to be due in we're going to be working on your assignment next week, but I'll talk to you a little bit more about that later on. Now, you'll notice in the corner of each PowerPoint slide, I've put a little box with P2, M1 and D1 in there. So on each slide, it tells you which criteria in the assignment that it all relates to. So that's going to help you when you go through it and work on your assignment. So first of all, let's have a look at what we learned in the last session. So we'll focus now on learning outcome 1. So just what have you learned? So just take a moment to think about what we covered in the lesson before half term. You can pause this video if you want to have a look over your notes. You can do that and then just come and join me again once you're ready. So as part of this unit, all the lessons we've done so far, we've looked at P1, P2, M1 and D1. Now they are the 4 criteria that are going to be covered in your assignment 1. So in the lessons before half term, I gave you all some guidance on assignment 1. You should be able to remember that. If you need to revisit it, then you can watch the YouTube lesson that I posted from the lesson before half term, in which I explain and break down the assignment for you. There's also PowerPoints on Teams as well that you can look at. And I'm going to prepare something else for you for next week to help you complete your assignment. So in our other lessons, we've looked at what health promotion means. So we've defined health promotion, and we've looked at the 3 different types of health promotion. We've looked at various promotion and health promotion campaigns in the UK, like Stoptober, Change for Life. And we've also looked at the benefits that health promotion can have on individuals. So assignment 1 requires you to explain the benefits of health promotion for individuals. So we've already looked at that, and you should be absolutely fine doing that. I'm going to go over that in the next slide though, just to make sure you know what you're doing. But the assignment also requires you to look at the benefits of health promotion for the nation. So that's what we're going to look at today. Okay, so let's actually start looking now at the different ways health promotion can benefit the nation. And again, you can see in the top corner of this screen, I've put P2, M1 and D1 so you know what criteria we are covering. So, health promotion and the nation. We've already looked at how health promotion can help individuals. So if you cast your minds back to when we did this, probably about 3 or 4 weeks ago, we said that health promotion can improve people's life expectancy. So if people follow the advice given by the government or by Public Health England or by the World Health Organization, then it might mean they could live longer. It also increases our understanding of health issues because they educate us about different health issues such as diabetes, coronary heart disease, obesity, sexually transmitted infections. So by us looking at adverts and posters and campaigns, it actually educates us. It also benefits us because it puts us at a reduced risk of getting a disease or injuring ourselves because we are made aware of the dangers of certain activities. Or, for example, in the workplace, we are told about how to lift heavy objects safely and carefully, and that reduces the risk of injury for our backs. It can improve quality of life as well. So, for example, if somebody gives up smoking because they've seen the smoking campaigns on the television, then not only will their life expectancy increase, but they'll have an improved quality of life. They'll be able to breathe better and they'll be able to exercise better because their breathing has been improved. So there's lots of ways it can improve your quality of life. It also lets people take responsibility of their health as well, because what health promotion does is it educates people and it informs people. And once you've got that knowledge, you can then take responsibility of your own health rather than relying on other people to do things for you. And it can change personal practices and lifestyle choices. So they are all how it can benefit individuals. This is all going into the assignment as well, but what we now need to do is take this a little bit further and think about how health promotion will benefit the nation. So what I would like you to do is just take a few moments to think about this and note down your thoughts. You might want to pause the video for a couple of minutes and just make a note of your thoughts on how it would benefit the nation. So how it would benefit the UK as a whole. Okay, so let's actually have a look at the benefits for the nation, shall we? So now this looks at P2, M1 and D1. There are lots and lots of different ways that health promotion can benefit the nation, so how it can help the nation as a whole. Now, some of these might have been written down on the lists that you've just produced for me, some of them might not. So, one of the main ways that health promotion helps the nation is by reducing levels of illness and disease. So, if people follow the advice given, then they are less likely to develop an illness or to develop a disease. And if you think about it, that means that the nation is going to be healthier as a whole. It also takes pressure off the NHS and reduces costs. So if you think about it, if we reduce levels of illness and disease, it means that less people are going to be going to the NHS, so less people are going to be going to hospitals, to doctors, to see healthcare professionals, which means that those healthcare professionals can then spend more time focusing on other matters and other important issues rather than having to deal with issues that people have, which they've basically done to themselves by not leading a healthy lifestyle. So, for example, if you encourage somebody to eat healthily, like through the Change for Life campaign, then that's going to reduce the chances of people developing obesity, which means less people are going to go to hospital with obesity-related injuries, obesity-related illnesses, and that means that the hospital will have more time to deal with other patients and more money to spend on those other patients as well. So they can maybe spend that money on research to make the nation even healthier. Now, you might not have thought about this, but health promotion can also reduce levels of crime. If you think about it, right, you might see all these adverts on the television encouraging people to stick to speed limits, not to drink drive, not to use their phones whilst driving. They are all criminal offences. So if we can educate people to do that, not only would we reduce the number of accidents that happen on the roads, but we'd also be reducing levels of crime because people would be not be committing as many criminal offences. Also, it increases the uptake of vaccinations and screening programs which reduce illness and disease as well. So it makes us aware of the need for vaccinations like the HPV vaccination or jabs, when we go on holiday, or the flu jab, which people have once a year to prevent them from getting flu or to protect them from flu. That does benefit the individual, but it also benefits society as well. It benefits the nation because it means that people living in the nation, living in the UK, are as healthy as possible. So these 4 need to be included in assignment 1, so make sure you are paying attention to this. Now I've got an example that I want to go through with you, and then I'm going to set you a task to do for the rest of this lesson and then the lesson this afternoon. So let's take this a little bit further. So this is the kind of thing that I'd be looking for in your assignment. So let's look at Change for Life. So you already know that Change for Life is a public health programme in England, and it began in January 2009, and it was set up by Public Health England. Now, Public Health England, as you already know, is the department within the government that looks after the health of the nation. So it makes sure that we've got, a healthy England. It was the UK's first national campaign to tackle obesity, and what it aimed to do, as we already know, is it aimed to reduce childhood obesity, and it wanted to do that by educating families and children on the importance of healthy eating and exercise. And it really was focusing on the fact that if you teach children healthy lifestyle lessons now, and if you teach them about the importance of healthy food and exercise, it means that in later life they are less likely to develop obesity because they've set good habits when they were young. So let's see the benefits of this campaign. So if you follow the Change for Life campaign, as an individual, we know it's going to reduce obesity. We know it's going to reduce or lower the risk of type 2 diabetes because you'll be having less sugar, less carbohydrates, less really sugary products in your diet. And then that's going to increase life expectancy. People who are obese will not live as long, or generally do not live as long as those that are a healthy weight. People with type 2 diabetes can experience early death. They can die early. It's a very, very serious condition, type 2 diabetes. So if you can get rid of all those, then it's going to increase your life expectancy, and it reduces the chances of people having a stroke as well. And it reduces the chances of developing coronary heart disease, because if you are eating less fat in the diet, then there will be less fat going into the body, more healthier fats going into the body, which won't clog up the arteries that go to the heart, which cause coronary heart disease. So they're the benefits to the individual. Let's now have a look at how it benefits the nation. And this is the bit that's going to achieve you the merits and the distinctions in this assignment. So this is important. Right, so the Change for Life campaign overall reduces costs to the NHS because more and more people go to the NHS at the moment with obesity-related conditions. So if we can change the way that people eat and change the way that they exercise and reduce the amount of people that have obesity, then that will mean the NHS will have more money to spend on other things. Important things like research into new life-saving treatments, or more research into health promotion to make us aware of other things we can do to improve our quality of life. It also reduces the levels of illness and disease. So what that actually means is it's freeing up healthcare workers so that they can focus on other matters. So not only are they saving money, but they're also saving time as well. Because obesity is something that people almost do to themselves, and it can be managed simply by eating a healthy, balanced diet and taking exercise. But at the moment, hospitals are really, really overwhelmed with the number of people that have got obesity-related illnesses. So if less people are going to hospital, that means hospital times are being reduced. So when you go to hospital, you can be waiting hours and hours sometimes to be seen. But if there's less people going because of conditions they've brought to themselves, then there'll be less time for you to wait. So what that actually means is really, really sick people will be able to get seen sooner and quicker, which might then improve their lives and make the nation a healthy nation. So that is an example of how Change for Life can help individuals and how overall that will then help the nation. Okay, so I hope you're understanding all this. Remember, you can rewind this video back at any time you want, just to have a look at, or to listen to things that I've said, or have a look at all the other slides. Now I'm going to set you a task, and this is what I want you to be working on for the rest of this lesson and also the lesson this afternoon. So on Teams, I'm going to show it to you in a minute, but on Teams, I've put a worksheet on there, and it's called Benefits to the Nation. What this worksheet requires you to do is explain the different ways that health promotion can benefit the nation. Now, when you've done this, all you really need to do is copy and paste it into the right format, which is a report format, and we can do this next week. But all you need to do is copy and paste it, and then that is pretty much the assignment done. So if you work really hard on this worksheet today, it's going to reduce the amount of work that you need to do next week. So even though we've just discussed 4 benefits of health promotion to the nation, there are actually 5 on the worksheet. I just wanted to challenge you a little bit. But I have been kind. I've done the first 2 for you so that you can see what you need to do. And then you can get an idea about how much detail you need to go into. So I want you to work on this for the rest of the day and then submit your completed work to me by 4:30 on Teams. Now do try to finish it because you've got plenty of time to do it today. If you've got any problems, I am here on Teams, so you can message me, you can call me, you can email me if you've got any problems whatsoever. And throughout the lesson, I will be contacting you all to see how you're getting on. So don't think you can just sit back and put your feet up and chill out. I want you to get this work done. The more work you do today, the less work you have to do next week, and the closer you are to completing that first assignment. Okay, so I'm just going to show you now the worksheet that I'm referring to. So this is the worksheet. I'll just make it a little bit bigger on my screen so that you can see it. So you can see here there are 4 columns. You will be able to find this in our folder for today on Teams. The first column lists the benefit. So I've put them all on there for you, as you can see. Now the bits in red and italics are things that I want you to think about. The blank bits are the bits you need to fill in yourself. And as you can see here, I have put examples of the sort of work I want you to produce for me today. So let's have a look at the first one. So the benefit is that health promotion reduces financial cost to the NHS and the government, therefore saving money. So in the next column, I've explained what that benefit means. So this means that health promotion activities could benefit the nation by saving money, because if a health promotion campaign encourages people to lead healthier lifestyles, then they're less likely to need to seek help from healthcare professionals. And then they're less likely to need treatment for poor health, which means the NHS has got more money to spend on treating people who actually need that help and care and support. And they can also spend money on other areas like research as well. So then, once you've explained what the benefit means, I want you to find an example of a health promotion activity that has benefited the nation in this way. Now, try not to use the same promotion or the same health promotion activity for each one. Try and find a different one, because that's what I'm looking for in your assignments, that you've looked at different health promotion activities. So the one I've used as an example for this is Change for Life. And then in this last column, I've explained how Change for Life has actually benefited the nation. And I had to do some research on this, so you need to use the internet. And I found some statistics and facts that support my answer. So have a read through that, and then use that as a guide as to how much information and how much detail I want you to go into. You can see there I've got 2 references, which is fabulous, right? So if you can get 2 references in for each one, that would be brilliant. It's really going to get you those higher grades in the assignment. So I'll just read through this with you very quickly. So I did some research and I found that an article in The Guardian, which is a newspaper, said that there's more than 2.1 billion people around the world. So 30% of the world are overweight. And it says it's costing the nation over £46 billion a year to treat people who are overweight or obese. And not only that, but another website I saw called Authority Nutrition said that unhealthy lifestyles can lead to conditions such as strokes, diabetes, and certain types of cancers as well. So, using the Change for Life programme to encourage people to eat healthy and take regular exercise will actually save the NHS and the government money, because less people need to access the services, and that money can be spent on other areas to try to make the nation healthier. So that is how it benefits the nation. I've also completed the second one for you as well, because like I said, I'm feeling kind today. So it reduces the levels of crime. So this means that some health promotion activities could benefit the nation because they educate and encourage people to behave in ways that reduce the amount of crime that takes place. So it could be like things like I said before, about educating people about the dangers of drug use or the dangers of drink driving or alcohol use, speeding, using your phone whilst driving. I've just spotted a spelling mistake there. So using your phone whilst driving. These are all examples of health promotion that, if you follow, could reduce the amount of crime that happens. Now, I've put an example of a health promotion activity there, and I've used, again, in the last column, some more references and some more statistics to show how health promotion about drug use can actually lead to a reduction in crime. So have a read through that, and then you've got to do these last 4 yourselves. So, increased uptake in vaccinations and screening programmes. Tell me what that means. Give me an example. So, for example, it could be where you think about, see where I've highlighted now in red. Think about the HPV vaccinations at school. How will that benefit the nation? This next one addresses high-profile health concerns. Think about like HIV awareness campaigns or sexually transmitted infection campaigns, public health campaigns about COVID, things on the television about smoking. They are all addressing health concerns that affect the nation at the moment. And this final one reduces levels of disease and illness. Don't just think about how it affects individuals, but think about how it affects the nation. So if you were going to be looking at, say, a campaign to encourage people to stop smoking, then for the person, it's going to reduce the risk of developing cancer. But for the nation, it means that the NHS will spend less money on treated smoking-related illnesses, so it can invest that money elsewhere. Something else you might want to think about there is the way that the government are trying to tackle climate change, because there's so much CO2, that's carbon dioxide, which is being pumped into the air at the moment, that in 20 or 30, 40 years' time, the climate is going to get hotter and hotter because we are burning a bigger hole in the ozone layer. So the government are trying to reduce the amount of CO2 that's going into the air. So that means there's going to be less pollution, which means the world's going to be a nicer, cleaner, safer place. And it's going to reduce the amount of people getting pollution-related illnesses. So less people going to hospital, less money being spent. Okay, now I am aware that I've spoken quite a lot on this video to you, but hopefully you should be able to understand what I've been discussing with you today. So you'll be able to find this worksheet on Teams. Just want to go back to my PowerPoint now. So you've got, like I said, until about 4:30 today to get that submitted to me. try to finish it. I've done the first 2 for you, so I've done a little bit of it already for you, so that's quite useful. So what we've done today, or what you will have done by the end of the day, is we've reviewed what we've covered over the last couple of weeks. We've identified and discussed 4 ways. You've actually looked at 5 different ways that health promotion can benefit the nation. We've justified them, and hopefully, once you've completed that worksheet, you will be on your way to planning the assignment, and we're going to work on the assignment next week. So you've got to complete assignment 1 next week. Do not panic about assignment 1. I'm going to make sure that next week you have everything you need to complete that assignment. Okay, like I said, you can speak to me on Teams anytime. I'm going to post all this onto Teams for you. I'll put the PowerPoint on Teams. I'll put this video on Teams. You've got that worksheet on Teams. How many more times can I say Teams? Right, speak to you all soon. Good luck, everybody. Thanks for listening. Bye.